Hello everyone, my name's Alan D'Souza. I'm the health lead for Enware. And part of the beauty of the Australian Health Design Council is being able to go from a cancer centre through to, we're going to talk specifically around the design of clinical hand wash basins and go deep into some science around that. So don't be afraid by the science. Michaela is going to run you through. It's some really interesting research and how we go to have human-centric and scientific approach to clinical hand wash and the basins and the tapware that goes with that. So I'm going to hand you over to Michaela.
Thank you, Alan. Good morning, everybody. My name is Michaela. I'm a PhD candidate at Flinders University. So today I'm going to give you a quick introduction into hand basin design and infection risk. So some of you may have heard of opportunistic premise plumbing pathogens before, but if not, these are pathogens that are naturally found in our distribution systems that can opportunistically cause disease in immunocompromised individuals. So this commonly occurs in hospital settings. These pathogens are regarded as a leading cause of water-related outbreaks, where in 2021 in the US, they were associated with over 7 million waterborne illnesses, 6,000 deaths, and costing over $2 billion in healthcare costs. These pathogens all share the ability to survive, persist, and grow in plumbing systems due to their ability of biofilm formation. This is when free-floating pathogens within the water attach to a pipe surface or plumbing fixture and form a kind of structural matrix that protects these pathogens against disinfectants, high temperatures, and other unfavourable conditions. So it's really quite difficult to remove an established biofilm. A common method is to flush these pipe systems out at a high flow. However, this just detaches those biofilms and causes them to travel upstream, forming at some plumbing fixtures. So a key healthcare plumbing fixture that is associated with biofilm formation is a hand basin. So a hand basin can become contaminated from the incoming water, but also through the simple act of hand washing. During hand washing, a patient or a staff can transfer their skin bacteria into the basin bowl and drain and initiate bacterial colonisation. Another form of contamination is through the disposal of liquid waste, which can travel into the drain and trap and present high concentrations of nutrients that are perfect for biofilm formation. So once that water stream is turned on, the water stream can hit a pair of hands, the basin bowl, or the drain, and it can create some splashing and aerosol generation. If that water stream were to hit a pair of contaminated hands, a contaminated bowl or drain, it is likely that some of that splashing and aerosol generation will have some bacteria within it. That contaminated splashing can then reach back up into the faucet outlet and contaminate the faucet, meaning that any water now passing through is going to have some bacteria in it. So patients can become sick through the direct contact of this contaminated water, through the ingestion or inhalation of aerosols containing bacteria, and through the indirect contact of contaminated water. So if this splashing were to reach a nearby bench top, any medical tools, or a patient bed, that patient then interacts with those contaminated objects and can become infected. So there are many ways that a healthcare basin sink can become an infection risk to patients. So it's really important that we begin to identify those design risks of basins and kind of understand how they can influence bacterial growth and transmission. That way we can ensure that all of our basin designs are informed by our current knowledge and are consistently regulated across healthcare settings to control that risk of infection. Therefore, I've done a quick literature review which assesses some current industry and government guidelines around healthcare basin design. I've then compared this to the literature that assesses the influence of basin design on bacterial growth and transmission. So to quickly go into some designs influencing splashing, a couple of studies found that clinical basin models with ceramic fins and hydrophilic glazes had significantly less splashing than basins that lacked these features. Another hospital study found that basins with rectangular bowls and flat bottoms had significantly less splashing than basins with curved sides. They had significantly more splashing. And it was also found here that as the distance between the water stream and the drain increased, splashing tended to decrease. Another 5 studies found that as water was flowing directly into the drain, there was significant splashing, often travelling up to 1 metre away from the basin bowl. However, when that water flow was placed offset to the drain, that splashing significantly reduced. So across the guidelines, only 9 out of 39 countries that I reviewed had guidelines that stated drains should be positioned offset from the direct water stream to reduce splashing risks. Other design considerations included basins to have curved sides, deep bowls, be compatible with the water flow, and have narrow rims pointing towards the drain. But overall, I found that design considerations did lack consideration into risks of splashing and pooling, and basin dimensions were significantly varied across the countries. So it's really important that we begin to understand how these designs can influence our level of infection control, and that way we can ensure that basin designs are designed to control our risk of infection. So that brings me to the new Enware design. So here is me and Jason Hines from Enware kind of running my basin model, which has been happening over the past couple of weeks. You can see that the drainage is quite good. The splashing tends to stay within that basin bowl and does not actually reach outside of the rim. It's quite a long video, isn't it?
Yeah, you can click through. You're right.
Across the past month, I've kind of done a pilot study, a lot of replicates, and I found that a commercial basin that lacked this ceramic fin and offset drain had significantly higher splashing outside of that basin bowl than the new Enware Clinical Type B design. So that's just really interesting. We have another kind of test that we did. If you think about a typical basin bowl, you're often dumping liquid into it, whether that be a vase or some leftover coffee, and it's just really interesting to see how that basin can drain. And there's a quick little understanding, and it drains pretty fast, which is good. And minimal pooling as well, we've found. Yeah. So thank you, everybody. I'll hand you back over to Alan, who can go through the rest.
Thanks, Michaela. So, with an understanding of the science, Enware went about, so part of Enware's DNA is around delivering healthy water and sustainable hospitals. To deliver healthy water and sustainable hospitals, we've really got to go from tapware into basins and really understand. And we've been looking at it for a number of years around designing a new basin, but it got put on the back burner as things do. And then it got to a point that, okay, we had time in our development program. We're ready to go, and what are we going to do? We want to create something new, something specifically for the needs of Australian hospitals, and we've come up with our new Type B basin. And so within this basin, it's got a couple of unique features in that it's got this anti-splash fin, it's got an offset waste. Now that waste is not only offset, but we've removed the capability to put a plug inside that waste. Now, in everywhere but the ACT, you don't need to have a plug, but it's the standard feature that's there. So we removed the plug to make it easy to clean and also ensure that the asset is being used for the purpose that it's intended. It's not intended to be used to be washing clinical equipment, to be all sorts of other things, cleaning your teeth, whatever, all the other stuff that we've seen go on in clinical basins around the country. So this is around making it easy to clean and also making it, being forced to be used for fit for purpose. Then we've also got the anti-splash rim. We've pushed the waste not only offset but also further to the back. We've removed bottle traps were previously utilised in this space. We've removed that. It's now a P-trap, but it's a P-trap that's offset that sits within the shroud, a removable shroud, which is really important for cleaning and maintenance. So the new Part D of the Australian Health Facility Guidelines, you can see, I won't go through every point of that, but you can see we've really addressed as much as the applicable parts of that Part D as we possibly could. And part of the Health Facility Guidelines says that the tapware and the basin should be viewed as a single item and should be assessed by the clinicians within that. So this pairs really nicely with our very successful range of clinical tapware by Enware. Now, part of the theme is designing for a changing world. Now, unfortunately, this is a reality of a changing world that the antimicrobial resistant pathogens are growing and are coming as a threat. When I hear one of Australia's leading microbiologists, Harriet Wiley, says as a mother that she stays up awake at night worrying about this, then I think this is something that we should all be worried about. And to the point that in 2050, more people will die from antimicrobial pathogens infection than cancer. All right. This is important. It's part of every hospital. They're dangerous places. We can make them less dangerous with really good design and really good application of that design. Thank you very much.